Can intra-arterial tenecteplase after thrombectomy improve stroke outcomes? Should patients be screened for hepatitis C virus in emergency departments regardless of risk? What are key differences between West Nile virus and Eastern Equine Encephalitis virus? This and much more on today's JAMA Editor's Summary. Hello and welcome to our listeners around the world. Today is July 11th, 2025. I'm JAMA Deputy Editor Dr. Preeti Malani, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. For this episode, I'm joined by fellow JAMA Deputy Editor Dr. Chris Muth. Hey, Chris, let's get started with a trial about intra-arterial tenecteplase.
Hi, Preeti. The ANGEL-TNK trial was a randomized clinical trial by Dr. Miao and colleagues that evaluated the role of intra-arterial tenecteplase after successful endovascular therapy for acute stroke. The researchers enrolled over 200 adults from hospitals in China who had successful thrombectomies for acute anterior circulation strokes, and participants were then randomly assigned to receive either local intra-arterial thrombolytic in the cerebral vasculature or standard care. The authors reported that intra-arterial tenecteplase after successful thrombectomy resulted in a greater likelihood of excellent neurological outcome at 90 days, which was defined as a modified Rankin scale score of 0 to 1. They noted, however, that more research is needed as the secondary efficacy analyses did not support the primary finding. I found this study to be interesting as it adds to the growing evidence base surrounding the use of intra-arterial thrombolytics after thrombectomy, and several of these studies, including the CHOICE trial, were previously published in JAMA.
There's also a trial this week about hepatitis C screening in emergency departments, the DETECT HepC trial. Dr. Hawkus and colleagues investigated the effectiveness of non-targeted hepatitis C virus screening in the emergency department setting. In their randomized clinical trial, patients presenting to 3 large U.S. emergency departments in urban settings were either offered hepatitis C screening regardless of risk or screening based on risk assessment. The primary outcome was cases of newly diagnosed hepatitis C infection based on RNA testing. The authors concluded that in this trial, the non-targeted screening approach was superior to the targeted screening approach for identifying new hepatitis C infections, although the absolute difference between the approaches was small.
Preeti, I learned a lot from the editor's note you wrote with JAMA Associate Editor Dr. Stephen Schenkel. The note mentions that less than a quarter of patients who tested positive for hepatitis C virus in the study were later connected to follow-up care, and even fewer initiated therapy for hepatitis C.
Thanks, Chris. And this is such an important and interesting point. We thought this nuance underscores the unique challenge for the emergency department as a place to screen, particularly when patients present with a completely different health concern than what they were being screened for. But the study offers a good roadmap for thinking about how the emergency department might be a place to perform public health interventions in the future.
In the next research article, Dr. Forrest and colleagues focused on trends in pediatric health. They used repeated cross-sectional analyses from multiple data collection methods from 2007 to 2023 to investigate a range of health indicators in U.S. children. The authors reported worsening trends in multiple indicators, including child mortality, chronic conditions, obesity, and loneliness. They also concluded that pediatric individuals were 1.8 times more likely to die in the U.S. from 2007 to 2022 than in 18 comparator high-income nations.
Dr. Wolf and colleagues wrote in an accompanying editorial. They explain how challenges in 5 key domains can contribute to declining pediatric health trends in the U.S.
And there's a research letter this week by Dr. Schwant and colleagues. The authors examined life expectancy changes in California using mortality data from 2019 to 2024. They reported that life expectancy remained lower in 2024 compared to 2019, and that cardiovascular disease contributed to deficits between 2020 to 2024 life expectancy relative with that of 2019.
Dr. Lowe and colleagues also contributed a research letter about obesity trends in Asian American and Native Hawaiian or other Pacific Islander adults. They analyzed BMI measurements from more than 1 million younger adults who self-reported as Asian American, Native Hawaiian, or other Pacific Islander and white. The authors concluded that the obesity burden varied across disaggregated Asian American, Native Hawaiian, and Pacific Islander subgroups. Trends also suggested a growing number of younger Asian American and Native Hawaiian or other Pacific Islander adults at risk for cardiovascular, kidney, metabolic syndrome due to elevated BMI.
And the editorial related to this study by Drs. Shaw and Khan summarizes the novelty of the study. They remark on the high prevalence of obesity in this young adult sample and the need for equitable approaches in obesity assessment and disease prevention.
JAMA published a viewpoint this week by Dr. Kramer and colleagues. They advocate for increased cybersecurity for digital medical devices like bedside patient monitors.
Dr. Ali and colleagues discussed considerations for implementing the ACGME international standards in low and middle income countries. They explain lessons learned from Aga Khan University Hospital, Nairobi, the first institution in Africa to receive this accreditation.
JAMA clinical content features a mosquito-borne disease cluster just in time for the summer. The JAMA review this week is about West Nile virus. Dr. Gould and colleagues summarize essential information on the infection caused by this neurotropic flavivirus. There's also an associated patient page and JAMA Clinical Reviews podcast. Here's a little bit of Dr. Gould's conversation with JAMA senior editor Dr. Karen Lasser.
I think just being aware of West Nile virus, thinking about it is really critical if a patient presents with, again, a febrile neurologic illness during the summer or fall. There are many arboviruses that can cause disease, but West Nile is far and away the most common and the most prevalent throughout the United States. And I think knowing the best way to diagnose patients, so using the appropriate test is critically important so you don't miss it. And that's, again, IgM antibodies in patients who are immunocompetent. And if you test somebody initially and it's negative, you want to repeat that test 8 days or more after the illness onset, because over 98% of patients will have those antibodies. And then, again, I think one of the things we've noted is with more immunosuppressed patients, more use of drugs that prevent people from mounting a humoral antibody response, you need to use molecular testing. And that's really critically important, particularly with patients who are on B-cell inhibiting monoclonal antibodies, that they're most of the time they're going to need RT-PCR testing. You can test serum if you don't have CSF. So there's a common misconception that you have to have CSF to diagnose West Nile, and that's not the case. So you can test serum and or CSF.
And to round out Mosquito Week, there's a JAMA Insights on Eastern Equine Encephalitis virus. Dr. Staples and Gould provide a helpful overview of this rare but serious mosquito-borne disease in the U.S.
To wrap up this week, there is a JAMA clinical challenge. Can you make the diagnosis for a 25-year-old with palpitations, fatigue, and migraine? And don't miss the most recent JAMA Plus AI Conversations podcast. Dr. Swen talks with Dr. Rudin about using AI to track asthma symptoms between healthcare visits. Here's a clip from that conversation.
Can you tell me a little bit about how patients use this application and the benefits of it?
Sure. And we've developed this app over many years with several rounds of user-centered design, getting a lot of good input from patients with asthma, as well as pulmonologists, as well as primary care doctors. And what we've learned from all these conversations and all these user sessions is that the main mechanism of action for this app is essentially that a lot of patients with asthma go through their lives, they have some exacerbations, they have some symptoms, but a lot of times they're not really thinking about it. They just get a little worse, and then they might think, oh, should I call my doctor? But we heard over and over again that they say, oh, I don't want to bother my doctor. And then their symptoms get worse and worse, and then they end up in the emergency room, or they end up with a really severe problem. And what this app does is it's very simple. It just asks them essentially how they're doing, 5 standardized questions, and it makes them more aware of their symptoms. And when they're more aware of it, then it makes it easier for them to recognize when they have a problem and a flare-up. And also the app helps make it easier for them to request a call from a nurse in their clinic so they can get help more easily.
As always, you can find the latest articles in clinical medicine, biomedical research, public health, and health policy written and researched by our outstanding JAMA Medical News team at jamamedicalnews.com, or you can click on the link in the show notes.
Thank you for tuning in to hear what's new at JAMA. These highlights were brought to you by Dr. Chris Muth and me, Dr. Preeti Malani. This episode was produced by Daniel Morrow, Shelley Steffens, and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.